Just be happy with who you are. Just be happy with who you are. Just be happy with who you are.
Hi, welcome to Schizophrenia Spectrum and Other Psychotic Disorders. Now, at the age of 8, Ellen Sachs began to experience the hallucinations and fears of being attacked that have accompanied her throughout her life. She understood the importance of not talking about, what went through her mind, and in fact, she was able to hide her delusional thoughts and hallucinations and maintain top grades throughout college. In graduate school, she experienced full-blown psychotic episodes. For example, believing that someone had infiltrated her research and dancing on the roof of the law library she did, and that resulted in her hospitalization and subsequent diagnosis of schizophrenia. Now, many of her symptoms persisted even when she began treatment. During one period, she believed her therapist had been replaced by an evil person with an identical appearance. In her book, The Center Cannot Hold My Journey Through Madness, Sachs, that was written in 2007, she recounts her lifelong struggle with mental illness, describing schizophrenia as a slow fog that becomes thicker over time. Sachs' struggle with schizophrenia, as well as her experience with forced treatment, resulted in intense interest in mental health and the law. Now, her doctors had painted a black picture for her future, and they believed that she would not complete her degree or be able to hold down a job or get married or any of the other sort of normal milestones of being an adult. However, Sachs did marry. She completed her graduate school. She is now the professor of law, psychology, and psychiatry at the University of Southern California, where she has also served as an associate dean. Now, I'm going to be posting a video of Ellen Sachs speaking about her illness in the Week 12 Journal 5. Please take the time to watch that video and another that I will be posting regarding those issues. Okay, let's get started at looking at schizophrenia and the spectrum. Schizophrenia is among the most puzzling and disabling clinical syndromes. Schizophrenia touches every facet of an affected person's life. Acute episodes are characterized by delusions, hallucinations, illogical thinking, incoherent speech, and bizarre behavior. Between episodes, people may still be able to think clearly and may lack appropriate emotional response to people and events in their lives. Now, in this video, we're going to look at some of the background history and review the phases and features of schizophrenia. So let's begin. Clinical features of schizophrenia on historical contributions and concepts of schizophrenia. And we're going to begin with Emil Kraepelin. He was the first to describe the syndrome we identify as schizophrenia. Now, he labeled the disorder dementia praecox and believed that this was a disease that develops early in life and follows a progressively deteriorating course. Now, Eugen Buehler, he renamed the disorder schizophrenia and believed that its course was more variable. He also distinguished between primary symptoms, the 4 A's, namely association, that's disturbed thinking, affect, which is inappropriate emotional expression, if you will, ambivalence of feelings, and autism, or the withdrawn into a more private and fantasy world. So those were primary. Secondary symptoms were things like hallucinations and delusions. Now, Kurt Schneider, he distinguished, let me begin again. Kurt Schneider distinguished between first-rank symptoms that would define the disorder and second-rank symptoms that occur in schizophrenia and other disorders. Hallucinations and delusions are numbered among the first-rank symptoms of schizophrenia, that is, the symptoms of schizophrenia that are central to the diagnosis. The so-called second-rank symptoms are found in other disorders as well. Now, Schneider considered, confusion and disturbance in mood to be a second-rank symptom. Kreplin, Bleuler, and Schneider have each contributed to how schizophrenia is viewed and diagnosed today using the DSM-5. So what about prevalence and cost of schizophrenia? Well, according to the best estimates, about 1% of the adult Canadian population suffers from schizophrenia at some point in their lives. Now, there are phases of schizophrenia, and usually schizophrenia develops in the late adolescence or early adulthood. Its onset may be abrupt or it might be gradual. And when we say gradual or abrupt, it could either emerge slowly through teens and in early adulthood, that's gradual, or abrupt. It could be that almost as, from day you're fine, you're having some struggles, to the next day you're showing immediate signs of schizophrenia. That would be abrupt. The period of deterioration preceding the onset of acute symptoms is called the prodromal phase. An acute or an active episode involves the emergence of clear psychotic features. The residual phase is characterized by a level of functioning that was typical of the prodromal phase. Now, there are major features of schizophrenia, and among the more prominent features of schizophrenia are disorders in the content of thought. Content of thought, we can put it in brackets to say delusions, that's content of thoughts, and form of thoughts. These would be more related to sort of thought disorders, disorganized speech, as well as the presence of perceptual distortions. Now, perceptual distortions are also known as hallucinations. Emotional disturbances, where you might get a flattening or inappropriate affect. Affect would be the emotional expression that you might have. When you go to a funeral, to be grieving and sad. Having inappropriate affect might be that you've laughed at that funeral. A flattened just means all your emotions and emotional content is level, flat. Now, also, we could look at some of the features to include grossly disorganized or catatonic behavior. Now, catatonic behavior isn't common. Catatonic would be, let's say you're sitting on the couch and at the moment that I say stop, you freeze and you don't move. And you may not move for minutes, maybe even hours. That not moving and frozen in space and time is what's known as catatonic behavior. All right, carrying on. Now we're going to start with the term, this is more current perspective, but we're going to start with are termed the positive symptoms of schizophrenia. Now, starting with disturbances in the content of thought, the most common of these delusions, false beliefs, that are enduring and lack any evidence. So when we talk about delusions and this content of thought and disturbances in that, is that there's a belief of something going on in the world out there that no one else sees or experiences, but that person does. And they're false beliefs. They're enduring, meaning they last a long time and they occur every day, and there's no evidence for those beliefs. Delusions can take many forms, including delusions of persecution. The police are out to get me, or any other person or group is out to get you. That's delusions of persecution. Delusions of being controlled, well, they're being controlled by outside forces, maybe agents, maybe the devil. Delusions of grandeur, well, that's the belief in the false impressions of one's own self-importance, believing to be Jesus, or that you're going to save the world, and not just that you're going to say it because you have some plan in some time in the future that you might in fact do that, but the belief that you can do it right now and for everybody genuinely. Now, there are other delusions: thought broadcasting, thought insertion, and thought withdrawal. Now, I've mentioned disorganized speech. Well, disorganized speech, daydreaming or just letting thoughts wander, or that's normal. Otherwise, our thoughts are rational, logical, and they're connected and tied together. Now, thoughts of people with schizophrenia tend to be more disorganized, illogical, and more disturbed. This is known as thought disorder, or a breakdown in logical associations between thought. Just meaning that it breaks down. You don't have a good connection to reality. It's kind of a loose connection. Now, connected to this is the poverty of speech, is also fairly common. And this is speech that is coherent, but it's limited and it's vague, with little informational value. Now, less common is the neologisms. These are made-up words. They have no meaning. They're just words that have been created. They have no meaning. They're not in the dictionary. You won't have seen or heard them anywhere else before. Or perseveration, which is the repeating and repetition of thoughts and words. Perseveration is the constant repeating of a single thought or a single set of words over and over and over again. You're stuck on it. You keep repeating. That's perseveration. Or clanging. This is another term which falls into this disturbed speech. Putting words together because they rhyme or they sound alike. Now, that's not typical in our speech, but in someone with schizophrenia, it may be. The other term, other than clanging, is what's known as blocking. That's the involuntary and abrupt interruption of speech or thought. Now, you will have heard, and I have mentioned, about hallucinations. Now, this includes images perceived without external stimuli, so you might see people out there that aren't physically there. Hallucinations can involve any of the senses. Visual and auditory are probably most common, but somatic, which are feelings, and gustatory, which are taste related, olfactory, which is smell related, and auditory, as I mentioned, and visual are the most common hallucinations. Now, auditory hallucinations occur about 60 to 80% of the cases, and can be the voice inside or external from the person. That is, it could be your own sort of voice on the inside of your head, or other voices on the inside of your head, or it could be external from a person, that is, experienced as self or other, a third person. Now, they can come in the form of a command: do this, do that, don't do this, don't do that. Or they can be instructions to do things like harm themselves. Now, causes of hallucinations are not known, but there are speculations. And brain chemistry disturbances, subvocalizations, or unrecognized self-talk are among the leading ones. The interconnectedness of our brain may, in some way, be responsible. Currently, it's undetermined about causes. Now, when they mean about the interconnectedness of the brain, because when we take in sensory information, it's not only going to one spot in the brain. It goes to a spot to be interpreted, but it also connects to other parts of the brain for the other elements: affect, emotion, descriptors, past experiences. All of these live in other parts of the brain. So that interconnectedness could be an issue, but it's undetermined, the causes of schizophrenia, in particular causes of hallucinations. Now, grossly disorganized or catatonic behavior includes examples of a childlike silliness and unpredictable agitation. The feature called catatonia is described when a person is unaware of their environment and will remain in a fixed, rigid position as if playing freezing tag, and they have been touched as if frozen in place. They can remain in position for minutes to hours. Those would be considered the sort of positive symptoms. If we move to the negative symptoms, it's characterized as the absence of normal behavior. Negative symptoms are deficits or behavioral deficiencies, such as social skills deficits, social withdrawal, flattening affect. The term affect, and thus flat affect, is essentially a lack of emotional expression in the face and in the voice, and lacking a normal range of emotional responses. The reality may not be no emotion complexity. Rather, emotions are not communicated to the outside world, but are experienced on the inside. It's undetermined. Other types of impairment can include hypervigilance, the oversensitivity to stimuli, not being able to filter out focuses. Okay, so what we've done is just really done a quick overview of schizophrenia and its more, what is it? What does it look like? What are the major features? Some of the history in terms of where we've been in the description of what schizophrenia is, and the more current view of the positive symptoms and negative symptoms. I hope this has been helpful. When we go to the second part 2 next week, you'll see we're going to look at theoretical perspectives and treatments. All right. I hope that's been helpful. Good luck, and we're almost there, everybody. Keep up the good work. Don't relax yet. We're not done yet. All right. Bye now.